Hello friends, I am Dr. Adiba and today we are going to discuss about Gaucher's disease. NEET PG 2021 question. What is Gaucher's disease? Actually, Gaucher's disease is an inherited disease. What do you mean by inherited diseases? That passed down through families. First most important point of Gaucher's disease is it is an autosomal recessive disease and due to the deficiency of glucocerebrosidase enzyme. Second most important point, this disease is the most common lysosomal storage disease. Lysosomal storage diseases are a type of diseases that causes fatty substances to build up in bone marrow, liver and spleen and causes the accumulation of glucocerebroside inside cells. The fatty substances, sphingolipids, weaken bones and enlarges the organs. What are the clinical features of the Gaucher's disease? Actually, the accumulation of glucocerebrosidase in bone marrow causes the hepatomegaly or hepatosplenomegaly. What do you mean by hepatosplenomegaly? That actually means the enlargement of liver and spleen. Other clinical features are bone pain, pathological fractures, bruising, thrombocytopenia, anemia, and neurological features may be present or absent. There is no mental retardation, there is no cherry red spot, but as we know that Gaucher's diseases are of three types, type 1, type 2 and type 3 Gaucher's disease. Among these three Gaucher's disease, most common type is type 1 Gaucher's disease. And we assume that, or rarely it is assumed that type 2 Gaucher's disease shows the presence of cherry red spot, which is termed as pseudo-cherry spot. Now, how do you do the Gaucher's disease diagnosis? Firstly, in leukocytes and fibroblasts, there is a deficiency of glucocerebrosidase. Secondly, we'll go for bone marrow biopsy and we'll find Gaucher's cells in bone marrow, which gives the appearance of wrinkled paper appearance, of cytoplasm or crumpled paper appearance. Now, thirdly, we'll do the X-ray long bones or X-ray of a femur and we'll find a deformity which is known as Erlenmeyer flask deformity. Now, do you do treatment of that Gaucher's disease? Yes. There are three methods in which we can treat the Gaucher's disease. There is no cure for Gaucher's disease, but treatment can at least relieve the symptoms. Firstly, enzyme replacement therapy. In enzyme replacement therapy, we use acid beta glucosidase or imiglucosidase. Second, substrate reduction therapy. And we use miglustat. Thirdly, the last and the stem cell transplantation can also be done. Thank you friends.